Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Kind of don't have things together because my guest is making me nervous. No, I'm messing. We are here for your Healthy Java. As we do every first and third Tuesday, we come in through the support of the Massachusetts General Hospital, Office of Equity and Community Health. We have been blessed for the past 18 months or so to have caregiving experts, doctors, physician assistants, social workers, coaches, psychiatrists, psychologists, cardiologists, endocrinologists, all type of physicians and doctors and nurses, and all across the scope of caregivers in the Mass General system. We've been able to do that and have this information because of this young man that I'm about to introduce, but present to most of you. Do me a favor and hit that share button, invite others in. As I mentioned on yesterday, He was not coming just for us to love on him. He is going to share some information. Health education is his passion. But Dr. Labre, I did tell folks what to do today in the comments. So you can, I mean, this is, your last kind of formal episode. So, I mean, what are you going to do? Hi, Dr. Labre.
Hi, it sounds like you're ready to embarrass me. Great.
So, so first
I'm
of
glad
all,
I made you nervous in the beginning.
no, I'm messing, man. I'm messing. But welcome back. This is a transparent space. We were really looking to see how we can build out this. Our last season, Dr. Alabre wasn't on camera as much, but he was definitely working in the background, ensuring that we've had all the great experts that have been with us these past 6 months. And so it's good to see you on screen, sir. It's been a while.
It has.
It's
It's
been a
good
while.
to see you. It's good to
All
be
right.
here.
So let's get the important. Both things are important, but in all seriousness, you exude health education. We've often talked about the importance of information and awareness. And so I did this is the one time I didn't check in with Dr. Labre too much about the flyer and the little blurb down. But I wanted to check in about, since you've been here, where do you see where we are, Dr. Alabre, with Black and brown communities in trends in healthcare? I'm sure you noticed your coworker, Dr. Basola, over at the Health Commission, they released that report that I reviewed some of the executive summary yesterday. And so I'm like, the timing of that and you coming on today is just like perfect. Not what came out of the report, but where are we, sir? Where are we from your perspective?
That's a good question. I actually been thinking about that all mornings. Like, where are we actually? It's funny that you started with that question. I'm an optimist. So
Okay.
I really always say we're farther than we were last month, last year, yesterday. But we're not there, obviously. And I think the most interesting thing for me is that there is more of an appetite for this type of information, for people to know what's going on, understand what's happening with their health, get involved, and take charge. So that's all very promising. We still have a lot of disparities, inequities, inequalities, unfortunately, as well. And so I don't have numbers. I don't know if you're looking for specific like statistics, but the thing is that we're still seeing differences in how care is accessed and how care is delivered, which is also very important because it's not on the part of the patients anymore. It's also on us, on the system, on the physicians individually. So there's a lot of work to be done. I have to kind of think about some of my patients. Sometimes you're sitting in the office and trying to help, and you're like, wow, there is so much more that needs to be done. You don't have access to these things. You didn't know these things even existed, which is part of the reason like we're doing this kind of work, is to get the information out there, allow people to know what they are entitled to, what they deserve, and be able to, unfortunately, ask for it at times because it may not even be offered. But we are doing better. People are really coming back to care. I am full, like
So you have
time.
Yeah.
And so in both newer patients, unfortunately, a lot of us don't have the capacity to take new patients, but there is a lot of people seeking care, looking to get primary care doctors, looking to stay on top of things, and the people who had been away for the pandemic coming back and asking, where am I? And you're like, well, it's been 3 years, so you're probably behind on a few things when we'll get the screening going. But it's encouraging that people are doing that and going back. Now it's a matter of figuring out a way to fit these people in and get them these appointments that they're looking for. There's a lot of levels in terms of where we are. I think access is an issue because there is a shortage of providers. This is not really helping the situation, but it's good in the sense that people are looking to have access. And so hopefully at some point we can meet the demand and be able to respond to that. And there's a lot of work being done on all of the aspects we talked about, equities and inequities and inequalities and whatnot. And so, again, I'm hopeful.
It's interesting because you touched on, when I asked where we were originally, I was morely asking from a systemic standpoint, kind of based on a report and where we were. But
Mhm.
you did talk about, and I've talked about this the past few weeks, about dual accountability. There is an accountability that we have as patients in Black and brown communities to when access is given and when information is available, to seize it and take advantage of it, with understanding that there are a lot of things that combat making health a priority. I'm just going to ask the folks that are, watching, to let us know just where do they place it, just so we can, have an idea.
Mhm.
But what do you, with the understanding of the issues that come sometimes in navigating the medical industry, can you speak to the importance of your statement? Your healthcare matters. Get it where you can. And I think that does the get it where you can. It inadvertently includes the issues that we've talked about. And so you got to get your healthcare and manage some of that stuff. But what is our responsibility to ourselves, Dr. Alabre? We've also talked about all the marching, the protest, everything that we've been doing for decades, and most recently since 2020. We have to be here to take
Right.
advantage of it. And so, what do you say to the responsibility that we have for ourselves in also filtering and seeing through the lens of life's issues?
Right. Um, Again, difficult, good question. I have to say, I am old enough to remember before we had somewhat, I am actually, Jimmy, universal, I mean, healthcare, or at least access to health insurance. Seriously, when I was in medical school, I was at BU. So Boston Medical Center was the one place that a lot of people from lower socioeconomic strata of the population of the society could get care, because they had that free care option that people could access. And then we moved to when we started to require health insurance for most people, if not all, and the health connector started, and all of these other things that people could access to that they had no way of accessing before. And I remember moving from BMC to MGH, where the population demographics started changing, because it was really interesting to see the percentage. I mean, I was talking about like maybe 1% Black and brown people, patients at MGH in 2007. And by the time I was done with residency, I don't have the exact numbers, but it was a significant increase where people now felt like they could access those other places that they were limited from, because again, they didn't have the coverage for it, because you had to be able to support yourself and pay a high premium to get insurance to be able to go to the places that only had those. And so in the city or the state had support for the program, the free care program, at limited areas. And so I think that's really helpful to see that people, once they are able to have, again, the opportunity to provide care for themselves, they do take advantage of it. And so in terms of your questions, like where the priority is, and it's hard for me to say, because people value their lives, I believe, and people value their care. And there are so many factors at play. So yes, understanding, prioritizing, putting health first and whatever it is great. But at the same time, if you have no money to do that, and you have no place to go, or you don't even know where you can go, I still refer a lot of patients to the patient financial services, because they don't know what they have access to, what kind of plans they can afford, or where they can go. So there is education to be done on that front as well. But again, as people get the word that they do have access to these things, I think a lot of times they do take advantage of it. Because I mean, really, without health, like this is, we talk about this a lot. Like,
Yeah.
do we need to tell anyone that you need to take care of yourself? And we do.
It's needed. It's really needed because, as you mentioned, life's issues and it's not, sometimes I can come across as being assertive, like, when we would talk about the vaccination and stuff like that.
Right.
But you do have to, he said, right. You do have to consider that if somebody has to balance the only appointment available because there's a shortage of providers, which is interesting to hear. Is it 3 p.m. on a Wednesday and I got to be at work? I'm more than likely going to go to work and not take that appointment. And so that is definitely fair. We have to know.
But we also can't blame people because it's such a complex situation. Because, I mean, for a lot of people, that missing that hour of work is not an option.
For many reasons. Financially, they can't afford that, whatever the hourly rate is. And even though employers are a little bit flexible because, employment, that's a whole nother Zoom in itself.
That's a whole
nother Zoom in itself.
Right.
But, they are a little bit more flexible, but then you got employers that may not be as flexible. You know what I mean? And so that is really.
And unfortunately, it always goes with the lower paying jobs, the people who have to take those jobs to make ends meet end up having no flexibility and no ability to do anything, and the hours are crazy, or they may even have 2 jobs or 3 jobs.
Yep.
And not that I'm advocating for this, but it is somewhat of a disservice we do to a lot of people in the population that we have office hours, clinic hours, exactly when most people work. And so
yeah.
I don't know that I want to work my weekends and my evenings, but
I mean, there's moonlighting and stuff like that where you can cover certain clinics and stuff that do that, but you're almost speaking to a policy issue that where legislators or whatever can move to have more flexibility, because on one hand, we are making progress. We have to note that. And the other hand, as you said, there's still room. I say a canyon. There's still room, to grow and do more. And so based on your preparation and what you were getting ready to do today, is there
in terms of what you were saying too, Jimmy, not to cut you off, but
Go ahead.
you were talking about the whole thing I had said very early on, get it where you can.
Yeah.
And I think that's also going to make a big change, because imagine you work 2 hours away. Let's not get too crazy. Maybe an hour away from your office, from the clinic. If that's the only thing you have access to, it only adds more to this difficulty of leaving that work or going there before you get to work. But if you have your clinic around the corner from where you live or where you work, you're more likely to access it, to be able to do that, half hour, whatever, out of your time. But if you're talking about going to a place where you're going to get stuck in traffic, where you have to drive or take the T or whatever it is, that's just not something you can do. And so having access, and that's where the policy also comes in. And I know there is certainly a big push to have care be delivered at the community level where the people are, as opposed to everyone coming to us in those major centers. And so that also should hopefully help in terms of access.
That's one of the things, and this is not coming from Dr. Alabre. This is a disclaimer. This is Jimmy saying this. This is why it'd be wonderful if MGH and somehow figure out to put a little MGH in Nubian Square and up toward this way, because you make a valid point that access is not just around information. Literally, physical access could better strategic placement of providers in these neighborhoods. It's funny because you can take the report that came out yesterday, and from a 23-year age difference, I think if it was 91, 23 years, 91 minus 23, I think it was 68, somewhere around there. Yeah, we're both doing it. That was so alarming. We heard it before. Congresswoman Ayanna Pressley talked about riding the #1 bus from Nubian Square up to Harvard Square and how the demographic and life expectancy changed. But it really is upon us and entities like MGH and others in healthcare systems that if they're really dedicated, and this is me saying this, when it comes, it's the bottom line. Healthcare is to some extent it is a business. And so you're going to want more people to come to your facilities, whether where they place and when they're placed, to have people that are going to make everybody that comes in welcome. And so that is a key point in your preparation for today, Dr. Labrie. Was there anything that you looked up, trends that you found that, might be one of those moments? Because I know you were not coming in just for us to love on you. And y'all get ready, because y'all get ready to share with Dr. Labrie the impact that he's had. And we won't have a lot of questions today, but we're going to have a lot of love.
I actually did not look up numbers or I know, can you believe? So I was following your orders. I was told I'm purely a guest and I had to just be here. And I also didn't want to bore anyone with crazy statistics.
It's not boring. Dr. Labrie, oh my God, in 18 months, if y'all knew how Dr. Labrie and I sometimes had a different approach to things, and the one time oh my God, that is funny. No,
it is really funny. I literally very purposefully, I was like, I will just do what he says and how he wants it. I'm gonna be here and just do what be myself.
Let's go. What was your favorite episode, either that you were a part of, or what was your favorite episode that we did together?
Honestly, I don't think I have one single one. My criterion for good episode is the ones with the most questions. So whenever come on, engagement is what I look for. So whenever I've watched every single one of them. I haven't missed a single. So so there's a lot of favorites, and 18 months to twice a month. There's quite a few there. But really, my idea about a good, are you okay?
There's something, all of my screens just went blank, but they're back now. Okay.
Yeah.
Oh, Jesus.
I didn't see that, actually.
Thank you. But you must have saw my face.
Yeah. So no, I mean, seriously, because we've talked about this. My intention is really to get people to be able to ask their questions, get their questions answered, have access to the experts. And I'll say it again, knowledge is power. I really want to be able to empower everyone to take control of their health, which is technically their life. And to be able to watch and see people get so involved and interested and engaged in asking questions, it's just what I look for. So any episode, if we could go back and look for the episode with the most questions from the audience, that would be my favorite.
See, you're good. You're part of faculty, so you're not going to say any names, so they won't. Hey, Claude. No, but with all due, it is.
But I'd like that number. I'd like to know, like the episode with the most engaged audience would be.
You're going to make now that the screen just.
I know.
So, I don't want to start fishing around. But no, if I remember right, the favorite episode when I did the Excel sheet, the favorite was dental, but I don't remember what the most watched was as far as numbers. But
right.
Dr. Asita was Asita was definitely.
Yeah, I remember that. That was a very engaging and
that last episode when he took the bottle and demonstrated as a matter of fact, I have to email into him, so when you talk to him, tell him if he could please get back to me, because
that's great.
This is so much more important now, and I just purchased. But no, Dr. Labrie, the other thing I wanted to ask, and I just noticed Cindy is in the room. So sad to see our production team change. Still can't believe it's been 18 months. Thank you to help build this, Dr. Labrie. You will be missed. He's still going to be somewhere around in the background. And if there's an episode,
I have a hard time saying no, but
no, but I could see you texting me and being like, Jimmy, that was good, but if you cover this episode again, you might want to think about including these objectives. No, but really, at this point, I'm going to ask everyone, and Rachel has started it, and so has Miss Teresa. And so I would like to ask you all just to share your love, appreciation, any impact this segment with Your Healthy Java has had on your life, in your life, loved ones, please go ahead and start to share that now. I will get a little joking out the way. Folks are in here like having MGH site in Nubian Square. Yes. What was the other thing I saw? I'm trying to wrap my head around having MGH in Nubian Dudley Square. Someone said it would be, where is it? It would be quite busy. So there's the population right there. And so I think I'm going to start with Rachel, who started it. She says,
I'm interested.
go ahead.
Go ahead.
Rachel says, Dr. Labre, thank you for being such an influential person in the Java Cafe. And Auntie Java said, absolutely, better placement of medical services so people can get there close to work. I'm just trying to comb through these. Also, these are also the comments, but let's show the love. Good morning, Dr. Labre. I wish I had one instance to share on how you have impacted my life. However, the truth is you've provided countless information for us to be better, healthier, and stronger people. Thank you for enhancing my life and the lives of many others. You will be sorely missed. And we saw Cindy's comment earlier. There are others. And Cindy is out here. Cindy, don't forget, I'm going to talk about the health fair on Saturday. And so Cindy is a huge part of this. We're celebrating Dr. Betancourt on Saturday. For those of you that would like to meet Dr. Labre, he will be there on Saturday at the health fair as well. And so I'm trying to think what else I want to get out of you since you're the guest and not, in medical director role. What, if anything, do you have a most funniest moment since we've been working together?
Let's see.
None that stands out.
There's a lot of moments.
A lot of those.
Funny. I think the funniest thing is when you first said this, and I was like, oh, I actually didn't even realize I was making the sound and having this. That totally cut me off guard, and I started to guard myself to not.
No, don't guard yourself.
I think you still managed to know when I was thinking it.
Yeah, you could see it on your. I mean, I know I'm animated, so I could read other people's faces, but I don't remember who was the guest, but the first time you had a couple of episodes, so you knew what was coming, and they said something. All you said was, uh-oh. I was like, listen, but those are those things that I think highlights that we learned a lot in this space. I mean, there are people the number one thing that stands out to me is the connection that we had gave my sister just a different level of comfort and resource because we were exchanging around her diagnosis with breast cancer. And then from there, we got connected with the Ellie Fund. We did that episode right there at Mass General. And so those are just like, that's one of the highlights. But I mean, a lot of people, I don't always share with you, but the inboxes and texts I get people, I have a parent, she's adamant. She was not getting the vaccination, but she said, watching our episode, she did what she had to do with herself, still masked, but she got her children vaccinated. There are people there's a sister, I don't know if she's in here today, and she was very open about it. A sister that went and got her mammogram from watching one of our episodes. Right. So, sir, we have had like absolute impact. And if you walk away with nothing else, you made I don't know I think it was you or Efren or someone that made the statement. And I need to check Twitter because I think some folks are on Twitter and I want to miss those comments as well. But someone made the statement about Dr. Betancourt has literally saved lives by, having this. Yeah. He put the support behind it and shepherded it. But the day-to-day in getting this done, that's been you. Navigating systems where it might not has been as many options to pull from people. Look at me smiling. It's about to be a moment. Might not be as many options to pull from people that look and resemble, you and I, or opposite of our gender. And so that is, I remember some of the times that, I've lent my own frustrations to this partnership, but then there was some frustrations, some times where it was interesting trying to get folks.
I just remembered actually now you made me think about the last health fair, the most impressive thing to me was I talked to about 3 people in the vaccine line, or at least in that area where we were doing the vaccinations, and they were pretty sure they were never going to get that vaccine when I first started talking to them. And then I just, asked, like, what's the concern? Is there anything you'd like to know that would help you make that decision? Because really, for me, as I've always said, it's about informed decision making. So like making decisions with the wrong information without being fully informed is obviously dangerous. And so part of this whole enterprise is to try to get people to make decisions and do things for their lives that is based on solid fact, on science and everything. So regardless, and I was really impressed that these were people that I had never met before, and they were able to open up and really share their concerns and their fears. And we talked for no more than 3 minutes. And before I know it, they were getting the shot. And I was like, how? Like, and this had already been almost a year and a half since the vaccine had been out when we did
it was in October, and I think
it was in October. So
it was over a year. It was definitely
over a year. Yeah, it was over a year. And I was like, all this time, what went wrong? How did you not get these questions, concerns answered and figured out until just now? Like, it took 3 minutes, and it happened again and again. By the third time, I was like, we really need to do more here.
But this is, as you said, this is why this platform and other investments that MGH, along with Adalberto and folks over at El Mundo that do something out of cafe, the hour of coffee. This is why
we get Aurora del Cafe.
Yeah, that one. Thank you, sir. But this is exactly why, and I just want you to see for sure, so you believe me. This is the young lady, sir.
That is awesome.
That was me that I got my first mammogram. And so it just, there are others. Sharon Cornelius, one of the mothers board.
Thank you for sharing that. I'll never forget this.
Listen.
I believed you, Jimmy, but it's like a whole different level when I actually see
I believe you, but seeing is believing.
I believed you, but this really takes it up a notch for me.
Sharon says, thank you for all the information that you have shared. What else I want to get out of you, especially when you've extended yourself to do it in the in-person talks as well, as you have been there. When we were at Sharon,
I'm totally gonna put in a plug for the health fair coming up, because I really truly believe it makes a difference to talk to someone live in person and be there. Because what I was saying earlier, that all that information that I think I shared with these people at the health fair had been out, and I'm sure they had heard it. They either had it from the wrong person, or it just made a difference to have that, one-on-one time and feeling that it's a lot easier to trust anyone, I think, and feel the connection. So, we have moved a lot to the virtual space, and, we are guilty of this. We're still doing this virtually, but the human connection need has not been lost. It's still there. Like, we all need that sort of, presence, and just it's unfortunate that we have been forced to move into this space of all being sort of on the web, but at the same time, that's why hopefully, as you have done, Jimmy, I know I'm not taking any credit for this. The health fair has been all yours. Being able to pull this together and doing it for your community is very. I'm losing my words here, but it's just that's awesome. I'm so happy you're doing that, and I hope people take advantage of it and show up and being able to see that the commitment is there from MGH, from the care providers, to be there to answer your questions and to provide. Unfortunately and sadly enough, the way healthcare is designed now, with time constraints and everything, there is a lot of it we just cannot do in the clinic, and then that's another realization I had when the pandemic first started. And I was really happy to be able to get involved with this, is because we couldn't do this in the 15-minute, 10-minute
No.
time you have with someone who obviously come in with a million other things to talk about. And so being able to have this sort of platform, this health information program, is really needed, and we need more of it. And I'm happy. I'm gonna, again, not to branch off too much, but it's been also in my mind to express how grateful and impressed, really, I have been with the core group of viewers you've had.
Yes.
2 days a month to commit to that hour to being here is pretty impressive, and I am very happy people are able to do that. And hopefully each one of these viewers are spreading whatever they're getting from here to others, and maybe that's why we get so many after our views, because the word is getting out. But I don't think I could commit myself to that many episodes every first and third Tuesday to come and get the information. So all of the Java family members who have been so consistent and committed to this, I want to thank you, actually. I know you thought this was for me, but I really do want to say a word of thank you to all the viewers as well.
It's interesting because Dr. Labre, when folks started going back to work, I'll just say 13. And when you were saying that, that was the number. But no, we it's the faithful. But again, this is interesting because this was the only segment that I did analysis on the afterwatch. Our afterwatch is 805%, which in real numbers average about 25 folks per week. And then an additional 175 more, average 200, go back and either share it or folks watch it after. And so I mean, from Nicole's comment to my sister, with all due with the wonderful investment MGH made, those are 2 lives. You can't put a dollar value on lives that were impacted. And we know that there's more. There's folks that got the vaccine we didn't even talk about, the registry, the Be the Match, the people that the people that signed up for the Be the Match, that 6 people did it, and we had about maybe 75, 100 people, and they said they have been to events with thousands and didn't get up to 6 people, and so the impact is really there. I'm just going to go back and check some more comments. Heidi is in. We'll miss you, Dr. Alabre. Rena, thank you, Dr. Alabre. My aunt Conchetta Johnson. I am a patient of the MGH Cancer Center now because I've trusted MGH for my health care when I was on life support, and follow-up care and teams were great. Mammograms showed something of concern. Ultrasound identified a biopsy with a biopsy. Don't put off getting those mammograms yearly. Early detection is life-saving. And so my aunt had already had a connection.
That is awesome.
I'm sure somewhere between my niece and my aunt had mentioned this to me the other day, and I said, connect with Misha to get connected, and they've already connected around the Ellie Fund and other stuff. And so, sir, impact is unequivocally cited here. That we've had.
That's the best, because I can only imagine the impact of sort of hearing it from someone who's gone through it from a patient has to be greater than hearing it from a doctor who may not have experienced it. We know we talk about lived experiences all the time, and I really think we should figure out a way at some point, Jimmy, or you should.
I told y'all he wasn't going
out. This is on you now to deputize each one of those core viewers to be the next health
ambassador,
ambassadors. Exactly. I think this is great, because really this is where the impact is going to come from.
With all that you're moving,
you can't give me time out.
No, because with all that you're moving on and doing, I wonder if I can talk with Dr. Basola, you, and we figure out some sort of 6-week course and train people and certify them as health ambassadors.
And
And you know you would do it. You know, if I got, listen, you did well for the 13. If I got 20 people to commit to come in for every other week, 6 weeks, and we were training them as health ambassadors, you would move. Tell me I'm lying. You would move heaven and earth.
Yes, you are not lying. That is absolutely correct. I mean, really, it's. I am in primary care. Obviously, I care dearly about this, and we talked about how we wanted to make this about taking care of yourself, preventive care, and whatnot. I know we haven't gone into it too much, but this is really where it's at. I mean, getting people to know that early detection matters, can save lives. Getting people to know that these things that are not causing symptoms, not bothering you, will impact you later. And I know, you probably haven't paid attention, but a lot of I'm sure you have actually, but a lot of the learning objectives that I send always have this thing in it about, like, how do we get people to care about those silent killers? And that's really the biggest things, because it is human nature. If something's not bothering you, we even have a saying about it: if it ain't broke, don't fix it. And so,
The sad part is it is, and we don't know.
Right, exactly. And that's the problem, because we have this ingrained in us, and we grew up thinking, oh, if it ain't broke, don't fix it. But this is the very opposite. This is where you want to actually fix it before it's broken, because by the time it's broken, it's a little too late. And so, or really, I mean, we could spin it a different way, because it is already broken. You just don't know it.
See, that's the whole point, that like, and if I walked away, and we're going to, continue and stuff, if I walked away and I'm thinking about this in real time, I think the last Dr. Asita talked about it. Asita talked about it, and I forgot who it wasn't Dr. Kareem. It was someone before them, and they did almost this crazy correlation, specifically with a lot of Black and brown folks, of the multiple silent killers, the intersectionality of the multiple silent killers that are moving silently at the same time. That was, I think, one of the major takeaways that I walked away with, like, wow, diabetes, heart disease, sleep apnea,
blood pressure,
high blood pressure, obesity, all of those things have a impact, and almost, for lack of better words, play off of one another. And I think the most scary thing that Dr. Isita talked about was, and I've been doing, not due diligence, but I have been seeking out a dentist, is that something that we don't know, a little toothache or something, and we just let it go as long. And if it don't hurt, don't fix it.
Right.
Can really start having a whole literally trickle down impact.
Yeah, absolutely.
And so it is, that is one of the main things I think that pushed me to do what we need to do to keep this platform, to have the health fair, to do eventually. I have some I have some sidebar off camera updates for you that might influence the ability to do in-person stuff. That's why we need to keep doing these, because what really stood out a few minutes ago was when I didn't even notice, I was running around like a chicken with my head cut off. But you was having those conversations. This is good. I'm not going to discredit what we're doing, but this, and I think being followed up by, and this is the familiarity. Some of them probably recognized, saw you know what I mean? And so we've talked about the ambassador piece. And so Cindy is here already talking about it. And you know what, Cindy, I got an idea. I'll figure out how we do it. But if somebody walks up to Cindy and says, I brought 3 people with me, Cindy, come see me, and they'll get a gift card.
There you go.
So Dr.
Seriously, and let's not forget that we are still at a point where representation matters. We know that. Okay. And so again, we have tried very to the best of our abilities, given the limitations that we do have, because we also have a problem with representation within the field of medicine. And so, to the best we can, we have done a decent job at finding people who look, sound, and everything like the people we are targeting, because it does matter. And I remember actually it was Karine who mentioned how she herself became a physician primarily because she happened to have a Hispanic pediatrician that when she was very little, I think 6 or 7, and she was like, wow, there's someone who speaks my language, looks like me, who is a physician. I just want to be like this one person. And so, these things do matter. You can have a whole discussion about why it does and why it should or shouldn't, but let's just go with practicality. It does, and so let's make it work, because in the end, it's about getting the work done. And so saving lives.
That's what we have actually, I really believe that we have. When whoever said it first about Dr. Betancourt, I believe it. And I think even you have contributed to that, definitely, because, and I'll end with this. There's this term called social construction. And what Professor Cuff Ferguson said was that you and I right now, we are reconstructing society. This dialogue, anybody that listens, that speaks about anything that we talked about today, is further informed through this conversation. And so it's going to eventually reconstruct society based on what? Conversations and engagement. And so that, sir, is if with all the frustrations, with the old Jimmy moments and whatnot, I really, sir, sincerely applaud and appreciate you for this, because Dr. Betancourt wouldn't be able to handle that day to day. Cindy it doesn't have the care, giver direct relationships. And so, and Natalie and in the business and others that were doing stuff, you were the one, sir, that was sending out the emails, letting them know that they would get the flyer and the link the night before. But no, Dr. Alabre, I really, really appreciate you, sir. And you will still, I hope that I can reach out to you and for a consult.
You have my number.
You need be, you know what I mean? And I just wanted to mention to folks that you all know Dr. Betancourt transitioned, and he even had, it's been public that a lot of healthcare industries, and it was surprising to hear that in healthcare, there is that concern about staffing. That is interesting.
Yeah.
But all entities are going through some sort of financial thing. So all that to say, we are still going to be here every first and third Tuesday for the next couple of months. I'm not exactly sure what 2 weeks from today will look like. We may repeat an episode. I may finagle some things because thanks to Dr. Alabre, I have 18 months worth of faculty that I control emails and say, well, they covered this. Let me see. But we are committed to staying in this space. MGH is still staying a partner. We're just figuring that stuff out in the background. But we're going to be here, and we're definitely going to be out on Saturday at 11 o'clock. And so I'm looking forward to this on Saturday. But Dr. Alabre, again, I really appreciate you, man, for the contributions you made, the leadership you provided, the objectives. I do look at them since we started doing them. They'd be on the screen, and I'd have the Word document or the email open.
I've been watching, I know.
How you gonna? Oh man, see, you got to mess with me. I don't know if you use them, so that you know what that means a lot, man. That you observed that I was looking at the objectives. So, Cindy, see, let's just end with a couple of comments in here, and they're talking about let me. I've worked in healthcare for over 20 years, and MGH is the only place that I know that has doctors that come out to their health fair. And so there are at least 13 divisions and departments from MGH, 6 community and wellness folks that are scheduled to be at the health fair. Pharmacy is coming. BC is coming with their graduate nursing program to do diabetes screening and weight checks and blood pressure checks. And so there's going to be a lot available on Saturday, and you're not eligible, but there's going to be some wonderful raffle prizes, a little flat thing with a screen that you might be able to watch TV on, gift cards, and we're going to have good food. So folks, don't forget to come out Saturday. Come meet Dr. Alabre. And I think that is it. I'm going to go on and actually, no, I'm going to go and get finished with you. And anything else, Dr. Alabre?
Let's see. You told me not to have an agenda, Jimmy. This is all on you. No, I think one of the thing I'd just quickly say, I don't know if anyone's watching, but you were mentioning how you have now 18 months worth of faculty. I do want to also say how willing and happy everyone has been to participate and be there. Again, that speaks to the commitment, not really at the institutional level right now. This is more a personal level, and that's why I think we do need to thank all the people who have participated and hopefully will continue to participate. The hardest thing has been me looking for the best and the best that I can get for you guys, for everyone to be able to have a conversation with, but not ever really about people wanting to do it. And so once I reach out, once I decide who would be best to do this, it's always been absolutely my pleasure. And so thank you to any of the faculties, all of them who've ever been here. And I know a lot of the viewers have always shown their appreciation. That's certainly been very well received and appreciated, because yes, we are very busy, as you can imagine. It's a lot of work. Everyone's schedule is packed beyond belief, and so they always find the way to carve out that hour to be here, and we hope that it's been for a good cause, and I believe it has.
It absolutely has. And Natalie, I don't know if you just jumped on, but we just mentioned you in the background, also handling business and whatnot. But Natalie says, "Thank you, Claude, for your engagement. It has been a pleasure, and looking forward to our continued work." Absolutely. I think that oh, Heidi said, "I own a staffing firm and can help fill positions." All right, Heidi. Let me find out. But no, I really no, you're good, Natalie. I just wanted to make sure you knew that we shouted out the physicians, Dr. Betancourt, Dr. Alabre, of course, Cindy, and yourself as well, Miss Pearl, in the background as well, scheduling and stuff. And so we appreciate everybody at MGH. We got to also mention Dr. Flores, Dr. Pachas, and Dr. Davila. I got it right this time.
Yeah, you got it. Yes.
Because they're doing equivalent within the Latinx community as well. And Dr. Betancourt's. So I was at Alberto the other day, and we sent Dr. Betancourt a picture. He nicely said, "I'm still waiting on y'all to do something together." So we got to figure that out, as well.
Right.
So I'm not going to hold you because I know you have other things to do. But Dr. Alabre, sincerely, again, I can't say it enough. Thank you, thank you, thank you. And we'll, see each other on Saturday.
You're very welcome, Jimmy.
All right.
Thank you, everyone. Thank you. And yes, I'll be around.
Say your healthy Java, because no one says it like he does. Say it.
Your healthy Java?
No, see, you didn't. I got to catch you when you're off. I like when you say Java. All right, Dr.
Your health matters. Get it when you can.
I think that's right. All right.
Should I sign off with that?
All right. Thank you, man. Thank you.
All right. Thank you, Jimmy. Bye, everyone.
Folks, don't forget on Saturday at 11 a.m., we are going to have the health fair. I really need you guys to come out. I'm going to be honest with you. I got a good, y'all see that sponsor right there on the bottom? They're looking to see what the impact is, and they are already talking about further collaboration. And so I need y'all, number one, to come out to stay healthy and get the health information. Also come out, some networking, some good time, Black Joy, food, and yes, raffle prizes, gift cards, a DJ. We're going to do some line dancing and some exercise. Cindy, I forgot to follow up with Damien's friend. Crap. We might have a couple of exercise physiology workout, y'all. What do you call them things? calisthenic, aerobics, that type of stuff. Saturday is going to be awesome, y'all. So make sure you spread the word. Again, if you're one of the first 100 that register, and of that 100, one of the first 50 that show up, you're automatically entered into a raffle to win $100. We're going to have $100 gift cards, $50 gift cards, $25 gift cards, flat screen TV, custom sneakers, a few other things. I'm actually going shopping in the next couple of days. We'll have snacks for the young people. We got life-size games, Connect 4, life-size Jenga. I'm going to look at the budget and see if we can squeeze another one in. Double Dutch. We got the parking lot and inside the Thelma Burns building. So spread the word and come through. And I'm going to say something. You don't even have to necessarily stay. It's a health fair. You come in, you're going to get a bag. And then you go around and get all the information, grab something to eat. Somewhere in there are going to be talks. We're going to check in with, we have a wonderful physician scientist from Jensen that is coming, Dr. Rick Lee from the Cancer Center of Mass General. We're going to hear from patients that have been part of clinical trials. That's what we're sort of focusing on Saturday. The importance of folks that look like you and I participating in clinical trials, to understand as they are with the vaccines and different things, as they are doing the clinical trials, to make sure that the makeup of our very type of melanin-based DNA is a part of the trials. The other piece about trials is there are currently things that are in clinical trials that are helping people. And if we don't participate, or if we don't know to ask, we don't get the advantage of it. And so that's part of the topic on Saturday as well. So yes, raffle prizes, good time, food, all of that. But the never, ever get it twisted. Health information is our mission. All right. So see you Saturday at 11 o'clock or anywhere from 11 to 3. Don't show up at 3 o'clock. No, anywhere from 11 to 3. See you on Saturday. And another thing to keep in mind is the raffles are going to be given out right after the talks. So make sure you don't miss the talk, because if you miss the talk, immediately after the talk, we're going to pull a couple of raffle prizes. So you hear a talk is coming on the announcements, make your way in there for the talk. All right, that's it. I'm tired. You know what? I'm not messing with you, Miss Teresa. Natalie, what? Now, the thing is, the MGH folks, and I know how y'all are. They wouldn't, even if they won, they would like donate it. But yeah, Natalie, we what you call it? I have single raffle tickets for the people who bring 3 people with them. Okay, and I got raffle tickets as well. Heidi's coming. Cindy said, "Okay, I'm tearing up." There was a couple of times, Cindy, where my eyes almost got moist, because Cindy knows. Cindy knows. Dr. Alabre and I just about 6-7 months ago just got a good dope. Hey, Mika, good to see Mika in the room this morning. I got your email all set. I'll reach out. Just got our flow like ridiculously tight, but we'll be good. It was no shade. But I'm getting off of here before I get in trouble. And I will see you guys tomorrow morning. We are going to revamp Woke Wellness Wednesday. I love the content and what Brother Carlin shares with us, but I want to, y'all just wait. Some in-person options, yes, are coming down the pike. Love you too, Ma. All right, I'm getting off of here. We'll see you tomorrow morning at 9 a.m. Don't forget, please spread the word about Saturday. Spread the word about Saturday. Shout out to Show Off Marketing. I don't know if you all have been in Grove Hall, couple in Codman Square. I think they're hitting Nubian Square. This brother has put our flyers up somewhere everywhere. And so if you see it, take a picture, post it. Seriously, all jokes aside, encourage people to come to get this health. They'll be able to ask nurses and doctors information right there in real time. They haven't examined them, but generally they'll be able to give them some advice. All right. So spread that information for me, for the community, not just for me. But yes, Brother Brandon from Show Off into, listen, I could show y'all some of the pictures where this brother has put flyers everywhere. So, all right. I said it before. I said it again. I'm out of here for real this time. We'll see you tomorrow morning at 9 a.m. Peace, everybody.